Now you're all sitting at home during this rainy evening watching at home. So tonight I will give you a quick overview about Hoag, and then we will quickly go over Medicare. You will notice that the first PDF link in the description is the presentation for Medicare, and it also includes the benefits from the representatives. Then we will introduce all of the Advantage Plan representatives. The second link that you see in that description is the comparison sheet. It's this sheet right here. So I would suggest you go ahead and print this out while I'm doing a little bit of chatting, and then this way you can jot down the benefits as the reps go over them. So a little bit about Hoag. We do have two main campuses, one in Newport and one in Irvine, with Newport being the original one. And then our medical staff is over 1,700 physicians representing 52 different specialties. Our institutes include neurosciences, cancer, heart and vascular, women's, and orthopedics, with orthopedics being Hoag Orthopedic Institute at our Irvine campus. Hoag, we are proud to say, for 2021, U.S. News World and Report has voted Hoag the #1 hospital in Orange County again this year. Little bit about our Hoag Health Centers. As you can see, they are throughout Orange County. The one that I do always like to highlight is the latest, and that is Foothill Ranch. Our Foothill Ranch Health Center is a little bit different. It's actually a health and wellness center. So we have a whole complete lifestyle program with a bio-circuit room, and the physicians there can prescribe you to that program. Our urgent cares, again, throughout Orange County. One thing I do like to stress about this, if you go to the urgent care website, you can actually see what the wait times are. So as you can see, there's multiple urgent cares in Irvine. Maybe you don't mind driving a little bit down the street because the wait time is 20 minutes less. You'll also notice that you can put yourself in line. So you can actually put yourself in line, and they will text you the time you choose before your appointment. Now, access to primary care, because we are talking about Medicare Advantage tonight. There are two ways that you can have access to all of Hoag, and that would be through Hoag Medical Group and Hoag Physician Partners. Hoag Medical Group is a group of 100+ physicians in basically in all of our health centers, and they also manage all of our urgent care locations. Hoag Physician Partners is a newer group, so we have a smaller group of primary care doctors, but you'll notice that we do have over 350 specialists. So please note that Hoag Medical Group does refer to the Hoag Physician Partner specialists. So if you go to hoaghealth.org with either one of these groups, you're going to have access to all of those physicians. A little bit about Hoag Medical Group. As I had mentioned earlier, over 100 physicians, and you'll see their locations listed there in Orange County. One of my favorite things with Hoag Medical Group is they offer same-day appointments to sick patients that are established. So they do actually carve out some time in the physician's schedule when you call. And if for some reason your doctor isn't available, there is another doctor in the office that you can see that day. I've only used it probably about 3 times, but I've never had any trouble getting in. And I haven't mentioned that I worked at Hoag either. Hoag Physician Partners, as I mentioned, is a new IPA. So right now we currently have 10 primary care physicians, but you will notice when it comes to the specialists, we're very proud to say that we have Orange Coast Women's Medical Group that has joined us. We have the Hoag Gynecological Oncology and the Urology Oncology. The plans that we'll be speaking tonight, and that both Hoag Medical Group and Hoag Physician Partners are contracted with, are Anthem, Blue Shield of California, SCAN, and United Healthcare. So with that, I am going to turn it over to Jeanette Paterka, and she will give you an overview about Medicare.
Good evening. My name is Jeanette Paterka, and I am with Paterka Insurance. I am here to review Original Medicare this evening with you. So the picture in front of you is the Medicare card. When you opt into Medicare, you will receive this card. And what you need to remember that's very important is the Medicare number that's located on that card. It used to be your Social Security number, but Medicare about a year and a half changed it to an alphanumeric number. So the reason it's important that you have this card on hand if you enroll into any type of Medicare health plan is that this is your identifier with Medicare, and that number needs to be placed on your enrollment form. And then underneath that, you will see Medicare Parts A and B. Part A is hospital, B is medical, and the effective dates of coverage for your Medicare for both of those parts of Medicare. So what is Medicare? Medicare is health insurance for the following people: individuals that are 65 and older. If you're under 65 and you have certain disabilities, you have to be deemed disabled with the Social Security Administration. Individuals that have end-stage renal disease, and also if you have Lou Gehrig's disease. These populations are eligible for Medicare. Medicare also has different parts. So Part A covers the hospital, skilled nursing, hospice care services. I like to think of this as covering the facility charges. Part A covers the facility portion of Medicare. Part B covers medical services provided by doctors, outpatient care, and some types of services such as lab services, MRIs, some of the testing you have. So Part B covers services you receive from either a facility or the actual doctor's office. And then Part C of Medicare is Medicare Advantage. Those are private insurance companies that offer Medicare health plans. In this area, they're mainly HMOs and PPOs, and those plans are approved by Medicare. So those are Part C. Sometimes you'll hear the terminology Medicare Advantage or MAPD. What that refers to is Medicare Advantage prescription drugs, which means the Part C plan includes the medical as well as the prescription drug plan. And then in 2006, Medicare introduced Part D, which is prescription drug plans. So there's two ways to obtain your Part D. If it is included in one of those MAPD plans, you can obtain it that way, or if you have original Medicare and a Medicare supplement, then you would need to purchase separately a Part D plan. So there's different parts of Medicare, and there's different ways that you are able to obtain the benefits. So Part A, original Medicare. Most individuals that work and pay into the system, it's 10 years or 40 quarters. So it's that Medicare deduction that goes out of your payroll and goes to Medicare. And so during your working life, during those 40 quarters, you're actually paying into the Medicare system. If you do work those 40 quarters, you will receive Part A of Medicare at no charge. Now, if you've not worked those quarters and you're short, or say maybe you're a stay-at-home wife, there's two ways to obtain that. If you haven't worked the full amount, you can either purchase Part A through Social Security, but if you have a spouse that paid and worked and has paid into the system, so if you're a stay-at-home mom and your husband paid into the system as an example, then you will receive your Part A at no charge as well based on his paying into the Medicare system. And then Part B of Medicare. So all Medicare beneficiaries must pay their Part B premium, and it's dependent upon your income. So there's different levels, and we're going to go ahead and go through those. What I want to make sure everybody understands about Part B of Medicare is that if you opt into your Medicare benefits, if you have your Medicare, your medical, and your prescription drugs, you have to have both Parts A and B. So you will be enrolled in Part A if you qualify, and then you elect to go into Part B when you're ready to start your Medicare. And then Part C, Medicare Advantage, those are those independent companies, the companies that are going to be speaking today are all Part C Medicare Advantage plans. Those plans are approved by Medicare. They're based by county, and sometimes they have a premium and sometimes they don't. It just depends on the plan that you're looking at and the location that you're where you live. Part D of Medicare, as I mentioned, is also approved by CMS, which is Medicare, and they are offered by private insurance companies at a premium. So these are the Part B income-based premiums for 2021. These numbers change every year. So as an example, if you take a look at the grid at that first line, 88,000 or less and 176,000 or less. So if your adjusted gross income as a single individual is 88,000 or less, you are going to pay $148.50 out of your Medicare award. That's what you're going to pay for your Part B premium for Medicare. Now, if you are file jointly, and then the number is 176,000. So if you and your spouse, your adjusted gross income is 176 or less, each of you are going to pay $148.50 towards Part B. Now, if you are receiving your Social Security, what I like to call the award, the money that they deposit in your account every month, that money will be automatically deducted out of your Social Security award. If you are still working or you've decided to delay your Social Security, they will send you a quarterly statement, and you need to pay that Part B premium every quarter. So as you see on the grid there, we went through the baseline, but based on your income, you could potentially pay up higher earning individuals can pay up to $504.90 for their Part B. So this is the 2021 Part D income-based premiums. So the grid on the left, the numbers are the same. So for an individual, 88,000 or less, or a couple filing jointly, $176,000 or less, they do not pay any additional amount for their Part D premium. But as you can see in the grid, if you're in one of those higher earning brackets, you potentially can also have to pay a monthly premium for your Part D plan as well. So now we're going to talk about enrollment periods. Medicare has many enrollment periods. So what we're illustrating right here is the enrollment period for when you opt into Medicare when you turn 65. So you have a 7-month window, and that window starts 3 months prior to the month of your birth and 3 months after. This is the time where you need to contact Social Security, let them know that you want to opt into your Medicare plan. What I would suggest is if you are planning on beginning your Medicare the month of your birth date when you turn 65, I would suggest contacting Social Security about 90 days prior and let them know that you want to go ahead and you want to start your benefits the first of the month. They always start the first of the month of your birth month, or whichever month you opt in, but you want to go ahead and contact them 90 days prior, and then they will have time to put your card together, make sure that you're eligible, and get that Medicare card out to you in the mail. Once you receive that card, you have that first 3 months is when you can enroll, and then you'll be effective on your Medicare the first of the month of your birth date. But you can say if you don't opt into Medicare until on this grid month 4, then potentially your Medicare is going to go ahead and start either months 5, 6, or 7. It just depends on what the effective dates, those Medicare Part A and B effective dates are on your card when you receive it. So the next enrollment period is the annual election period. This is October 15th to December 7th. This is the time, if you are already established on a Medicare Advantage or a Part D plan, this is the time that you can make a change. This is the time where you need to take control of your health insurance coverage, take a look at what you have, and determine if you want to have that same coverage for the following year with the same plan. In the beginning of September, you will receive, if if you're on a Medicare Advantage or Part D plan, what they call the annual notice of change. That is a notification that shows what your benefits are for that current year, and then what the changes can be for the upcoming year. And if you want to make a change and move to a different type of plan or switch maybe insurance carriers, that's the time to do it. So you can change or enroll in a prescription drug plan. You can change your Medicare Advantage plan, and you can also go back to original Medicare and opt into a Part D plan. So this is the time you can make the change. Those applications, if you want them to be effective the first of the year, so January 1st, they have to be submitted between October 15th and December 7th, and then they will be effective on January 1st. And then Medicare, a couple years ago, enacted or began a new enrollment period, which is the open enrollment period. So this is from January 1st through March 31st. So if you're enrolled in a Medicare Advantage plan, you have a one-time opportunity to switch to a different Medicare Advantage plan. So as an example, if you started a new plan in January and you went to the doctor and for some reason it just wasn't working out and you weren't happy with the plan, and you decided you wanted to maybe go back to your original plan or try a different plan, this is the time that you can make that switch. So you can switch to a different Medicare Advantage plan, or you can drop your Medicare Advantage plan and you can go on original Medicare and then purchase a Part D prescription drug plan. So this is one more opportunity that you can go ahead and make. It's a one-time switch during this period, January 1st to March 31st. And then whatever plan that you are on as of March 31st, then you are in the lock-in period, which is April 1st through December 31st, and then the whole cycle starts over again. So there are special reasons that you can, change your plan throughout the year during that lock-in period. If you're in the same location and you don't move and you don't have any circumstance changes, you have to stay on that plan the remainder of the year. But as an example, if you move out of the service area, so Medicare Advantage plans are, as I mentioned, filed by county. So as an example, if you lived in San Diego County and you are on a particular plan and you moved to Orange County, that would be a special election, a special reason that Medicare will allow you to enroll mid-year during that lock-in period on a new Medicare Advantage plan. You also can potentially every quarter if you are on a special needs plan. So what that means is Medicare has particular plans that are designed either for individuals that have chronic, as an example, chronic conditions. So some of the most common ones might be if you have heart disease or if you have diabetes. If you have one of these types of conditions, your doctor needs to certify that you have the condition, and you potentially can move on to one of the plans that are specific to that particular condition. Or individuals also during the year can change if they have Medicare and Medi-Cal. So Medicare is the federal program and Medi-Cal is the state-run program. So if you're a full dual beneficiary, that's the term that they use, you have Medicare and Medi-Cal, you can make a change during lock-in period. Or if you're low income subsidy, I'm going to go into that a little bit more in detail, but that's for individuals that are maybe at a lower income or a fixed income, but don't necessarily qualify for Medi-Cal. Okay, prescription drugs. This is the 2021 prescription drug information. This also changes from year to year. What I want you to remember is that this is the baseline. The thing with the Medicare Advantage plans and the prescription drug plans is that all of the plans that you're going to see today after I present, all of those have benefits that are at minimum what Medicare requires. I call it the baseline or better, more enhanced. So as you're going to hear, many of the plans have very enhanced benefits. In this particular illustration, prescription drugs, this is the minimum, the baseline. So many plans that you look at will possibly or potentially have better coverage than this. But what the minimum is when you start your plan in January, you have to first pay your deductible. So you're going to pay the first $445 of your prescription drug costs for that calendar year to get through your deductible. And then once your total drug costs once you pay that deductible and your total drug costs reach $4,130, you are in the initial coverage limit. So what that means, the way that you reach that $4,130 in this illustration is it's a calculation of the total drug cost. So in this illustration, it's a $25 prescription drug. The insurance company is going to pay $20. You pay a $25 copayment, and then $25 is deducted from that initial coverage limit. And once you pay between the 4130, or once you hit the 4130, then you're going to go basically go into a different phase of your prescription drug plan. It's called the coverage gap or the donut hole. So what this means is a temporary change to the way that you pay for your medication. Once you hit a total combined drug cost of $4,130, you're going to pay 25% for your generics and 25% for your name brand drugs. And once so you're in the initial coverage and the limit, you're paying the 25%. Once you hit that, then when your total combined drug costs hit $6,550, then there's another change to the way they calculate your payments, and you're going to pay $3.70 or 5% for generics and $9.20 or 5% for any other drugs, and you pay whichever is greater. So I mentioned low income subsidy. That's the program Medicare has that is for individuals that are not necessarily, they don't qualify for Medi-Cal. So it's individuals that usually are on a set income, maybe a lower income, and depending on your level, you can pay, as you can see there, $0 to $3.70 for your generics, or $0 and $9.20 for your name brand medications. What you need to do to check and see if you are eligible for this is you go to Social Security's website, and there is a link there that says Extra Help. You go into this website. It's a federal program. I would invite you that if you think they're going to show you what the guidelines are for your eligibility as far as your income. If you think you're even close or maybe a little bit over, I would invite you to fill out. It's a very easy application. Fill it out and submit it, because they might not consider all of what you consider to be income, so you may qualify. You'll be notified if you do, and then those are the amounts that you'll pay for your medications. So what this is a Medigap comparison table. They call it Medigap or Medicare supplement. It's used, really, those names are used interchangeably. So there's a couple things I want to mention about this. These plans are standardized. These are the types of plans that when you have original Medicare, Medicare pays a portion of your bill, and then your Medigap or your Medicare supplement picks up the secondary portion or some of the remaining balance of that bill. There is a premium for these plans. It's a monthly premium, and it will go up sometimes 1 or 2 times a year. It might be an annual rate increase. The plans are standardized. So in this example, if you're looking at a Plan N with Blue Shield of California or United Healthcare or Mutual of Omaha, the benefits will be identical. So you don't need to worry that one company or another is going to have different benefits. So if you choose a plan, the benefits will be the same. What you want to look at is what the rate is, because they can charge, each insurance company can charge a different rate for those benefits. You also want to take a look, you can look up online what the historical rate increases are for that particular company. Some companies are a little bit more stable, and so the rate increases are a little bit less than other companies. So you can look up the historical rate increases, and you can also look up and see what the ratings are. So each of the insurance companies has a rating, and it starts at A and it goes down. So you want to make sure that you purchase a plan from a reputable company. I'd like you to focus, this is my last comment here, I'd like you to focus on the box on the right. Plans C and F are only available if your Medicare eligibility date was prior to 2020. What that means is, say say your birthday was in February of 2020, you would be able to purchase a plan C or F. The other example, if your birthday was in 2020 or earlier, also earlier, and say you're working and you don't opt into your Medicare benefits until maybe you're 67, maybe it's 2023, you can still purchase a plan C or F. It's all based on when your benefits when you were eligible initially for Medicare. So with that, I am going to go ahead and turn it over to Brandon from Anthem Blue Cross. I thank you for your time.
Good evening. My name is Brandon Roberto, and I'm a direct agent for Anthem Blue Cross. And this evening, I will be discussing the Anthem MediBlue Select. It's a Medicare Advantage plan here in Orange County. For star rating, it has 3.5 stars. There is a $0 monthly premium. For primary care physician and specialist visits, it's also a zero copay. The maximum out-of-pocket is $900 on this plan. So what that means in a calendar year, the most you'll pay for medical-related expenses is $900. For hospital copay, it's $0 per stay. For emergency room, it's a $120 copay. But if admitted within 24 hours, that copay will be waived. The ambulance copay is $200. For outpatient surgery, it's a $0 copay. A skilled nursing facility copay is $0 days 1 through 20, and days 21 through 100 is a $75 copay. For x-rays and laboratory, it's a $0 copay. For MRI and CT scans, it's a $95 copay. For diagnostic testing, it's a $0 copay. Physical therapy is a $0 copay. For urgent care facilities, it's also $0 copay. Now we'll go over the medication cost. For Tier 1, preferred generic, it's $0 copay. And for a 90-day mail order supply, it's also $0. Tier 2, generic, is a $5 copay. And if doing a mail order 90-day supply, it's a $0 copay. Tier 3 is $42 for a 30-day supply, and if doing 3-month supply mail order, it's $84, so you save 1 month. And for Tier 4, it's $95 for a 1-month supply, or $190 for a 3-month mail order supply. Tier 5, it's 33% coinsurance, and it doesn't matter if you're doing a mail order, it'll still be that 33% coinsurance. Tier 6 is not applicable on this plan. Then Anthem gives you a lot of extra value-added benefits. We also provide dental coverage. We give you 2 cleanings and x-rays every calendar year. And we give you a $100 allowance. And we use a Liberty Dental Network, which is like a PPO type plan. You can go to any dentist that accepts Liberty Dental. We also provide hearing aids, and that's a $0 exam and a $3,000 hearing aid allowance per calendar year. And for vision, for your eye exam, it's $0 copay, and $150 for eyeglasses or contacts every calendar year. We also include Silver Sneakers, which is like a universal gym membership that gives you access to over 16,000 gyms nationwide. LA Fitness, Gold's Gym, 24-Hour, YMCA, Planet Fitness, Crunch Fitness, they all accept Silver Sneakers. We also include transportation, which is an Uber service. We give you 24 trips up to 60 miles each trip. We also give you an $80 OTC allowance, which is good at Walmart or CVS for health-related items. You can get hand sanitizer, vitamins, toothpaste, toothbrushes, blood pressure monitors, digital thermometers. So there's actually over 1,000 items you could choose from. You also get access to our personal emergency response system at no copay or service fee. All you have to do is call Member Services and you will get one if you're on this plan. We also provide the personal home helper, 31 days, up to 4 hours a day. So if you need help with 2 or more daily activities, you can access this benefit. We also give you acupuncture, 24 visits without a referral to any acupuncture in network. We also offer chronic special need plans, and we have MedSup if interested. And now I'll pass it on to Diana from Blue Shield.
Bright lights. Good afternoon, everyone. My name is Diana No. I am an independent licensed agent, and today I will be representing Blue Shield of California. My contact information will be listed in the chat box, but for folks who are viewing this at a later time, you may not see the chat box. So my telephone number is 949-226-4064. So a little bit about Blue Shield. They are a not-for-profit company based here in California and have been in the market for over 80 years. They offer a variety of products such as Medicare Advantage, Medicare supplements, and prescription drug coverage. So what does that mean for you? They're a one-stop shop. They'll have a plan or a product that will best fit your needs, lifestyles, etc. Okay? So for today, Blue Shield does offer a variety of Medicare Advantage plans, but today I will be covering the benefits for the Inspire plan. So if you have a copy of this, you can go ahead and follow along and jot down the notes for the benefits I'll be sharing with you. Blue Shield star rating is a 4-star. There is a 0 premium for this plan. So besides what you pay to Medicare Part B, there's no additional premium, so 0. For your primary care visits and specialists, it's also 0 copay. Your maximum out-of-pocket for the year for your medical services and hospital services is $999. That is your safety net. So that's the most you pay for your medical expenses if you had to for the year. For your hospital, unlimited days, it's also 0 copay. But if you had to land into the emergency room, it is an $85 copay. Any emergency room, worldwide, $85 copay. Also on this plan, let's say you're traveling outside the United States once you're able to travel, and you encounter an emergency, you are covered at unlimited expenses, minus the $85 copay for the visit. If you need to call the ambulance, it is a $100 copayment per trip. So for example, I just talked about the emergency room copay and the ambulance copay. These dollar amounts will count towards your maximum out-of-pocket, okay? For outpatient surgery, so if you need cataract, the not-so-fun colonoscopy, it can range between $0 to $150. So 0 if you are having the procedure done at an ambulatory surgical center. If it's done at the hospital, hospitals do have a higher overhead cost, so it will be a $150 copayment. As for skilled nursing, so this is if, let's say, you had a procedure at the hospital, you're well enough to leave the hospital, but not 100% well enough to go home, you may be discharged to a skilled nursing facility for extra rehab services. So for the first 20 days, you pay 0. If you end up staying at the skilled nursing for a little bit longer, from days 21 through 100, it is a $50 copay per day. But once again, you do have a maximum out-of-pocket of $999 for the year. The next few items, there's going to be a lot of zeros, right? So for your x-rays, your lab, your MRIs, CT, PET scans, diagnostic testing, physical therapy, even urgent care, all is 0 copay. Moving along to our prescription drug coverage, Blue Shield has a very strong formulary, so list of medications they cover. So I'm going to give you the copayments for the medications, the different tiers. I'll be giving you a 30-day supply copayment as well as a 90-day supply copayment, okay? So this is gonna be for our preferred pharmacy pricing. This would be the CVS, Costco, Walmart, so those locations, okay? For tier 1, 30-day is 0, 90-day is also 0. Tier 2 is $3 and $4.50. Tier 3 is $35 $187.50. Tier 4, so this is the non-preferred medications. We're looking at $95 for a 30-day supply, and $237.50 for the 90-day supply. And lastly, for Tier 5, this is typically the specialty drugs like injectables. They are running at 33% coinsurance. Okay, on this plan, there is no Tier 6. Moving along to dental coverage. So this plan does offer basic dental coverage. It is included with a nominal copayment. You do need to use the doctors that participate in the network. However, if you want to have the flexibility to see any dentist you'd like to see, you are able to upgrade for a dental PPO plan with this Inspire product. Hearing aids is also included. It's a zero copay for hearing exam, but let's say you need a hearing aid. Blue Shield offers 2 different hearing aids. There's the basic version, which costs $449 per ear. That is your copayment. And for the reserve hearing aid, which is more of the higher end hearing aid, it's running $699 per ear. As for your vision coverage, it is a zero copay for your vision exam. So this is when you need to get your glasses or contacts. You have a $200 allowance to use towards your frames or contacts every 2 years. The vision administrator for Blue Shield is VSP. So VSP is accepted at most locations, but some of them, just to name a few, you have lens crafters, private optometrists, I have to double check Costco, my apologies, but you have JCPenney's, Sears, etc. As for the health club membership, yes, it is included. Blue Shield uses silver sneakers, so you have access to many of the major gyms in the area, such as 24 Hour Fitness, LA Fitness, YMCA. However, since we are in the pandemic, many of the gyms may not be open, so if you hop onto silversneakers.com, you can find online classes. Once a member, you may be able to receive some in-home equipment where you can have when you can use during the online sessions that they offer. Transportation is also included on this plan. You get 24 one-way trips for your doctor visits, the pharmacy, labs, etc. You just call in and schedule an appointment and someone will come pick you up. Now down to the fun stuff. So the extras. Blue Shield does offer extra benefits. So for example, there are over-the-counter benefits. You get a $90 allowance each quarter to spend on items like vitamins, Band-Aids, cotton swabs, hand sanitizers. It's a use it or lose it benefit, so you must use your $90 each quarter because it doesn't roll over. Acupuncture and Chiropractic Services is also included on this plan. We use a network called the American Specialty Network. There's hundreds of contracted chiropractors and acupuncturists on the list. You receive 24 visits each, and it's zero copay for those visits. There's also the personal emergency response system. So a few years ago, you may have heard the commercial, "Help, I've fallen and I can't get up." So it's a device very similar to that. With Blue Shield, you have a couple options. You can either get the GPS mobile device if you tend to walk around or are a bit more mobile, or you have the homebound device, which is either a bracelet or a pendant. Lastly, telemedicine is also available on this plan. Let's say your doctor office is not open and you need to talk to someone and can't connect with your office. Telemedicine is available, and you connect with board-certified physicians to assess your situation. If you need antibiotics, medications, etc., basic stuff, they'll be able to assist you, okay? As I mentioned earlier, Blue Shield does offer Medicare supplements, very competitive pricing. The top-of-line plan for individuals that are turning 65 soon is the Plan G and Plan G Extra. And of course, for more information on the Inspire plan or the Medicare supplement plans, you're welcome to give me a call. Once again, my number is 949-226-4064. Thank you for your time, and I look forward to connecting with you. Sorry, I forgot. Need to introduce my fellow colleague. We have Joanne Baudet with SCAN up next. Thank you.
Hi, welcome this evening. I'm so glad you guys are here. My name is Joanne Boudet. I work for Scan Health Plan. Just a little bit about myself. I've been doing this for almost 30 years. I've been doing this with Medicare for so long that I am one, hence the gray hair. Scan has been in business for almost 45 years. We are a not-for-profit organization, and our home headquarters is in Long Beach. We have a member service department there that works from 8 in the morning to 8 o'clock at night, and we actually answer our phones. You don't have to push any buttons to get a hold of a representative, so that's really nice. And we have contracts with majority of the medical groups in Orange County, LA County, Riverside, and San Diego, and of course we have our contract here with Hoag. So I'm going to go over the benefits with our classic plan, and then we also have a plan called the balance plan. Now the balance plan is designed towards people that are diabetic, whether it's a type 1 or type 2, and the classic plan is designed for anyone who lives in the service area. We are a 4.5-star rated plan. This is our 4th year running in a row that we've had 4.5 stars. We're very proud of that because it's not an easy task to get. We are zero premium for the classic and the balance plan, and also it's a zero copay for the primary care doctor or the specialist. Maximum out of pocket, I'm sure that's been explained to you, but it is the maximum you would pay towards copays, anything to do with Part A and B of Medicare. Ours is $799 on the classic plan, and same as with our balance plan. Hospital copay is zero for both plans. Emergency room is a $90 copay. However, it will be waived if you are admitted to the hospital, and you'll pay zero for that emergency room as well as the hospital stay. Ambulance is a $100 copay, and that's paid directly to the ambulance company, and that is part of that maximum out-of-pocket I mentioned, the $799. The outpatient surgery, that could be cataract surgery. We're doing hernias, gallbladders outpatient. There's even my brother had a partial knee replacement outpatient. It's all a zero copay. Skilled nursing is going to be a zero copay. However, if you stay longer than 20 days, then you would be paying a $50 a day copay from day 21 through 100. X-rays and laboratory visits, like your lab work, is all zero. MRIs and CT scans are all zero. The diagnostic testing would be like radiation treatment is a $50 copay. And physical therapy, occupational, and speech therapy are all zero copays. So it's a pretty good plan. We should have named it the zero plan instead of the classic plan. Urgent care is covered worldwide. So if you have an emergency or urgency, as soon as this, we all get our vaccines and are able to start traveling again, you can get urgent care or emergency care worldwide with us. And the urgent care is going to be a zero copay. X-rays and, prescriptions. Okay, we have 5 tiers on our prescriptions. We give you your generics are tier 1 and 2. Most of the brand names are going to be tiers 3 and 4, and then the specialty drugs are on tier 5. 3 ways you can get your medications with us. You can go into a preferred pharmacy, you can go into a standard pharmacy, or you can use our mail order system. So preferred pharmacies is CVS, Rite Aid, Walmart. You can go to Vons, Albertsons, Costco. Those are all our preferred pharmacies. The standard pharmacy is going to be Walgreens, Medicine Shop, and a lot of independent pharmacies in the area. You can still use them, but you're going to pay a little bit more, between $5 and $7, between $7 and $10 more if you use a standard pharmacy. But if you go to a preferred pharmacy, these are going to be your prices. So if you walk into a preferred pharmacy like a CVS or a Rite Aid, you're going to pay zero for your tier 1 medication. You'll pay zero if you want a 90-day supply, and this year SCAN is actually giving you 100 days if your doctor requests it for you. And then if you use our mail order service, which is the 3rd way to get your medications, it's called Express Scripts, you can get a 90-day supply for zero copay as well. Tier 2 is going to be $5 for a 30-day supply, so maybe like an antibiotic or something like that if you walk into the pharmacy. If you do want to use the walk-in pharmacy and get a 3-month supply, you'll pay $10. But if you use our mail order system, anything on Tier 1 or Tier 2 is going to be a zero copay. So you stand to save quite a bit of money that way. I know I personally take a couple medications that are on Tier 2, and instead of paying $10 every 90 days, now I can get it for zero. Okay. Tier 3 is going to be where most of the brand name medications are, including insulin. So SCAN covers insulin on our classic plan at a $25 copay. We've taken a reduced rate on insulin for any diabetic that needs that. But our balance plan is the one that's designed for the diabetic, and that would be a zero copay for your insulin, even though it's a Tier 3 and it's a brand name. If you are a diabetic, this is the plan that you should take a look at. What's nice about the balance plan is that it does have open enrollment all year long because it's considered a special needs plan. Tier 3 regular medications outside of the insulin are going to be $37 for a 30-day supply, or you can get a 3-month supply at the pharmacy or the mail order, and you would pay $91 for that. And the Tier 4 are the ones that are very expensive. We see them advertised on TV all the time. They're expensive medications. It's $95 for 1 month, or you'd pay $265 and get a 3-month supply. The next would be Tier 5, which is specialty drugs, and that's a 33% copay. Dental, we have a special program set up with Delta Dental, and we cover you for routine dental, and all of our plans that would be you could get your teeth cleaned and your x-rays or even a deep cleaning at no charge. But if you want extra benefits, like you want discounts on crowns and root canals and things like that, it's a $10 a month copay for that to upgrade to our essential dental plan, and that's ran through a group at Delta Dental. Hearing aids is the company we use for that. Is called True Hearing. We have 2 ways to get our hearing aids. You can go in to get a hearing exam at no charge. And then if you needed a hearing aid through True Hearing, they use the really state-of-the-art hearing aids. You would pay $450 or $750, depending on which type of hearing aid you needed. They're really great because they're Bluetooth ready, and you can use them with your smartphone or your smart TV. Vision is through iMed. That's Sears, JCPenney, Target, LensCrafters, and a whole lot of independent optometry offices. You would go in, and we have a frame allowance of $175 towards your frame, and we have a $30 copay towards your lens. Health club membership, the same as what you've been hearing pretty much across the board. It's going to be silver sneakers. Transportation, we do cover you for 24 rides on our regular plan, on our classic plan. That would be 24 one-way or 12 round trip. But if you have the balance plan, now you get 30 rides, okay? And there's no charge for those rides, and that could be wheelchair accessible vehicles as well. Extras, this is where we really shine, in my opinion, okay? We cover you for chiropractor and acupuncture. You get either a $15 or even just a $5 copay, depending on which plan you're on. Over-the-counter items, we give you $30 to spend in our catalog, and that $30 does roll over to the next quarter. If you forgot to order or you're waiting to get something that's a little more expensive, you can roll your $30 into the next quarter, even into the third quarter. At the end of the fourth quarter, it starts all over again in January. Okay. Podiatry Services, you can go in for 6 toenail clippings and callus removal 6 times a year, and there's no charge for that. Telehealth is calling a board-certified physician 24 hours a day, 7 days a week. Those doctors can even do your prescriptions for you. You can do it on a smartphone, you can do it on your iPad, or you can just do it on a regular landline. But the one that I like the best is called Returning to Home. This is where a service where if you ended up in the hospital and you needed some extra help when you got home, maybe you needed somebody to come in and help you take a bath, maybe to come in and do your laundry or change your linens. We will send somebody out with 40 hours worth of care for you at no charge. At a 4-hour increments, that could be 10 days worth of somebody coming out to the house and helping you around the house, helping you take a bath, get ready in the morning, that type of thing. Included with that is also going to be 28 days worth of food delivered to the house, and there's no charge for that. That's 84 meals, and I heard the food was pretty tasty. Okay. We have respite care, so that if you did have a family member taking care of you, we could have somebody come in and take that family member's place and take care of you, so they could go to a family wedding or do some running errands or go to the doctors or just get a break from. I always say from me, because I'm probably grumpy if they have to stay with me all the time and take care of me. Emergency response system, the help I feel I can't get up, we also offer that to our qualified members. And I think that's it. I think I've covered it all. We have plans designed for people on low income, but please give me a call. My name is Joanne Boudet. My number is 714-272-8983, and I'm happy to help you or answer any of your Medicare questions. Thanks so much. Bye-bye.
Hi, I'm Rosalie Pulio with AARP Medicare Solutions with United Healthcare, and thank you so much for being here this evening. We really appreciate your time. As I said, my name is Rosalie Pulio. My number is 714-292-3796. A little bit about United Healthcare. United Healthcare is a Fortune 6 company, and they have most of the members of Medicare Advantage in Orange County, so that's pretty exciting. The plan I'm going to talk about today is called the Focus Plan, and it's a great plan. It has 4 stars, and just as most of the other plans that you've heard today, it's a 0 premium, okay? 0 copays for physicians and specialists, as well as virtual visits is going to be a 0 copay. Now, we have the maximum out-of-pocket is going to be $1,000. So any co-payments that you pay, which is very few, will go towards those $1,000. Now, hospital copay is unlimited amount of days, and that is 0 copay. Emergency room, it's $90. If you're released from the emergency room, then you have to pay the copay. However, if you are admitted from the emergency room, then it's going to be waived. One of the other things about the emergency room copays is that internationally is a 0 copay. So if and when we can ever travel again, it will be a 0 copay if you need to go to an emergency room. Now, ambulance. The ambulance copay is $225. And I always like to tell my clients to get the city plan, and that is a $5 a month plan that's attached to your water bill, and then you don't have to pay the ambulance fee. Now, with United Healthcare, the ambulance fee is also good for air, land, or sea. So if you are on a ship and you need to get airlifted off of a ship, they will pay that, and it would be $225. All right, so outpatient surgery copay, whether it's in a facility in the hospital or outside of the hospital, is going to be 0 copay. Skilled nursing, so the first 20 days is going to be 0 copay. The next 9 days is $100 a day, and that would go towards your out-of-pocket maximum. Then days 31 through 100 is 0 again. So basically, out of 100 days, you're paying for 9 days. Now, your labs and x-rays are all 0, and MRI, CT scans are $0 to $50. Diagnostic testing, the non-radiological, is going to be 0 copay. So say you need a biopsy or something like that, that's going to be 0 copay. All of your therapies, physical therapy, speech therapy, occupational therapies, are all 0 copay. And they also offer home health. Now, urgent care If you go to the medical group that you are in, say you're going to go to Hoag Medical Group and you go to Hoag Medical Group Urgent Care, it's going to be zero copay. But if you go outside of your medical group, then it's going to be a $20 copay. Now, internationally, it's going to be zero again. So just so that you know, all of our benefits, all the medical benefits are worldwide, and you would be paying zero copay for that. Now, let's talk about your prescription drugs. So Tier 1 is, for 30 days, is going to be a zero copay. Now, for Tier 1 for 100 days is going to be zero copay as well. Tier 2 is zero copay for 30 days and zero for 100 days. And then Tier 3 is $47 for 30 days, and then it's $131 for 100 days. Now, insulin this year, they reduced the cost of insulin to $35, and it remains $35 through the donut hole. So that is a great new benefit. Now, the Tier 4 is $100 for 30 days and $290 for 100 days. So your doctor has to order the 100 days, but then at the end of the year, you get a month free of medications. Tier 5 is 33%, and there is no Tier 6. So let's go talk about the extras a little bit, and these are kind of fun. So the first thing, as far as the dental is concerned, you get 3 cleanings a year with the HMO dental. Now, if you wanted to select the PPO dental buy-up, it's $40 a month, and you get $1,500 worth of dental benefit, which is great. Hearing aids. The exam is going to be zero copay, whether you go to United Healthcare Hearing or if you go to your physician and he sends you to an audiologist, it's going to be zero copay. The hearing aids are only $375 per ear, or up to $2,075. Now, with the vision, you can go to one of the optometrists that we have on the list, and there's hundreds of them here. And then you get $300 towards frames and lenses, or you get contacts every 2 years. Health club membership. So we have what we call Renew Active, and that is a wellness program, and that's going to give you opportunity to go to all the different gyms that are around, just like you can with Silver Sneakers, but it also adds brain games and recipes and personal coaching, etc. But the other benefit that it has, which is great, is that it will give you money for taking care of your health. So if you go have your physical and you have a mammogram or you have all your tests done, you can call United Healthcare and they will send you so much money for it, up to $150 a year. So that's a great benefit. The transportation is 24 one-way rides, and that's zero copay as well. And we do have the personal emergency response system, with Philips Lifeline, and that's zero copay. And the podiatry, we give you 2 visits, non-referral, per year to a podiatrist just for maintenance type drugs. Maintenance type care of your feet. If you needed surgery, that would go into your medical benefit. Over-the-counter products, you get $50 a quarter, which is great. And then we have chiropractic. You get 12 visits at zero copay. And then acupuncture is 12 visits as well. And you have a 24-hour nurse line. But also there's a new thing that just came up, a new service that they included this year. It's called Navigate for Me. So say you become ill and you need to have help with navigating through the healthcare system or making appointments for you. It's your own personal concierge person that will help you through those different times and get you the care that you need. So I think that's about all for me. Again, my name is Rosalie Pulio, and I'm with AERP, Medicare Solutions with United Healthcare, and my number is 714-292-3796. Thank you again for being here, and I'm going to turn this over to Josephine. Okay.
Well, thank you everyone for attending this evening. If you have any questions about the individual plans, please feel free to give the representatives a call. This video will remain up on YouTube so that you can maybe replay it and see what you missed. Thanks again.